morning and good afternoon and good evening, dear colleagues. It's my pleasure to welcome you to this session of the EMPHNET webinar series titled Investment in Artificial Intelligence to Promote Public Health in the Middle East and North Africa, Current Status and Future Challenges. Artificial intelligence is rapidly transforming public health, from surveillance and early warning systems to data-driven decision-making. The question before us is no longer whether AI will influence public health. It already is. The real question is how we as a region, will invest in it, govern it, and apply it in ways that are equitable, ethical, and impactful. Today's webinar brings together leading experts to reflect on these critical issues, share practical insights, and explore realistic pathways for integrating AI into public health systems across our region. Our focus is not only on innovation, but on implementation, on how to move from potential to practice. Before introducing our first speaker, I'd like to kindly remind participants to use the QA feature for any question during the session. With that, it's my great honor to introduce our first speaker, Dr. Mohannad Al Nsour. Dr. Al Nsour is a globally recognized leader in epidemiology and public health systems, widely regarded as one of the most influential figures advancing applied epidemiology. He holds a PhD in epidemiology and is a fellow by distinction of the Faculty of Public Health in the United Kingdom. Since 2009, Dr. Mohannad has served as Executive Director of the Eastern Mediterranean Public Health Network, where his visionary leadership has transformed the organization into a leading regional public health institution, EMPHNET. He is also the founder of the International Academy of Public Health. Dr. Al Nsour has held important leadership roles globally, including serving as chair of GOR. He also contributed to academia at leading institutions such as the American University of Beirut, and currently serves as an adjunct professor at Iraq Medical and Health Sciences University. Dr. Mohannad, the floor is yours. You are muted.
Thank you very much, Dr. Youssef, for this introduction, and it's my honor and pleasure being with you today after such a long time, maybe.
Welcome back.
I will talk I am very interested in this topic, and I think it's very important to us as well. So artificial intelligence in public health. And I will just, within 5 minutes, maybe 7 minutes maximum, to go over a few slides that I think it's very important to us and to the region to be aware of and stand on that issue. So artificial intelligence is coming. This is first fact that we should realize, and we need to link it specifically to the public health. So we started in the globe, starting using artificial intelligence in different ways in public health, mainly to protect and detect disease outbreak. And we saw this during COVID-19, improve the efficiency of health system and resource allocation, accelerate research and innovation, and we saw different countries focusing on research using AI and expanding to the use of digital health services and tools, strengthening health promotion through targeting communication. So these are the major areas of work in public health and artificial intelligence. So where is the globe and where we at Eastern Mediterranean region stands? So as we see in the table, we have top leaders who are coming from always from North Africa, Europe, China, and we have strong emerging leaders from mainly from East Asia, South Korea, Singapore, and Japan, I can say. And then it comes to the mid-level accelerating regions, and here the East Mediterranean region or East Middle East and North Africa stand, which is, mainly Gulf countries, and we will come to this later on. And we have the fourth tier or fourth phase, which is developing limited capacity sub-Saharan Africa is there, part of South Asia as well. As Dr. Yusuf said, AI provides a powerful opportunity to enhance decision making, improve efficiency, and ultimately. And he beautifully stated the importance of equity, where the AI helping us with reaching the equity, which was one of the major challenges over the past 2 decades and more. So ultimate goal of using it's not only innovation and implementation. It's our ultimate goal to reach, to help us with saving lives, and this is what we always like to talk about. So to be realistic, EMR is not leading global leader yet, but AI in East Mediterranean region it's coming and is fasting growing region globally. And final position that's globally mid-tier, rapidly advancing, regionally high and equal, and we saw this, and the future potential high, especially GCC. So this is, summarize where the globe is, where the Eastern Mediterranean region and other regions stand for. So once again, when we are talking about the tier one, which is, AI was integrated or is integrated to public health integration, it's mainly Saudi Arabia, United Arab Emirates, Qatar. Why they are leading? Because they already, they have strong national AI strategies, major investment in digital health and AI, integration in surveillance, diagnosis, and population health. And, we have, very clear example it comes from Saudi Arabia and United Arab Emirates. Saudi Arabia, they incorporated the AI driven, within the vision of 2030. And we saw that United Arab Emirates was, addressed and was highly stated in the Davos conference a few months ago. So for the second tier, so Iran, Jordan, Egypt are there. Mainly, these are the major countries in from Eastern Mediterranean region, and we have active in research and AI publications. And I can say that Iran is pioneer in this area and developing digital health strategies, some implementation in surveillance and health systems. So we are in the tier two if we look at these countries. And again, we need to know other countries, so this will help us later on to better understand their country situation. And we see that in tier three, we have Lebanon, Pakistan, Morocco, Tunisia, Oman, and Kuwait. And they have, some pilot projects, limited scale of fragmented implementation. And comes to the tier four, which mainly Yemen, Sudan, Somalia, Syria. They have weak infrastructure so far for the artificial intelligence, limited AI deployment, and heavy reliance on donor-driven system. So this is, again, summary that I will not go through it, but it's rapid assessment, strong political commitment, and growth in research and collaboration. And these are the key weaknesses: fragmentation, system often not integrated, and this is common in the region without AI, but it's growing and becoming more obvious when we are talking about AI. Limited national strategies, only 7 countries out of 22, they have full digital health strategy, and inequity across countries, which is, inequity across regions. Now we are talking across countries, and later on, maybe, we will talking within the same country. We have these, inequality issues that coming up. We need to move faster, but very carefully, and we should not be in rush under pressure that we need to scale up the artificial intelligence. This is true, but we have to be very careful and to make sure that technology is evolving faster than our policies and governance system, and this is very critical. And there is always concern about data privacy and security concerns remain significant among countries and regions, and there is really risk of widening inequality if artificial intelligence is not implemented responsibly. So these are the major things that letting us think more about, how we can escalate or how we can fast the using of the artificial intelligence. And so after this, quick, understanding, so we need to position Infinite, and this is specifically for Infinite, how we can position Infinite as a regional hub in AI for public health. And as I said, as better we understand our countries, as better we understand the current situation, we can put realistic plan for Infinite and for any other regional or country students. So we look at this, we have the major problems with artificial intelligence in Eastern Mediterranean region is mainly lack of trained public health workforce capable of utilizing AI. We have weak integration of AI into surveillance and decision-making system and limited regional coordination and knowledge sharing. And these are already and absence of operational framework and implementing AI. So these are the major weaknesses area that AI suffering from in our region. That's why these based on these we could build our role and to see how Infinite can fit to these areas. So according to the Infinite strategy and the mandate of Infinite, we can contribute and participate in strengthening workforce capacity, and we can support country implementation. We can move into the enhanced regional coordination, and we are already doing that, and we need to enhance it in the area of artificial intelligence. And finally, we need to generate evidence and knowledge. So if you look at this side and you see that Infant is doing its role as doing in other areas. So as implementer, maybe implementing party or, help, we can, beautifully contribute to this work. And again, Infinite is not alone. We have to believe that we are working with other colleagues and other agencies, and these are the major players like UN, including WHO, UNICEF, UNHCR, and FAO, of course. And we have to work closely with the ministries of health, academic institution. We will for research support and other things, and NGOs and the private sectors. So priority areas, as we said at the beginning, disease surveillance and outbreak detection, non-communicable disease, primary healthcare is very important, and pandemic preparedness and response. Thank you very much. I know I tried to be very short according to Dr. Yusuf recommendation last time. Thank you.
Thank you, Dr. Mohannad. You being short but very informative, actually, and you set the scene for this discussion. It's worth mentioning, basically, that this webinar is inspired by a report on AI in the EMR that is led by you. And this work actually has helped and will shape the foundation of this and the future discussion. Thank you very much. Thank you. Now, I'd like also to remind you, please use Q&A feature. Now, I'd like to introduce our second speaker, Professor Radwan Qasrawi. Professor Qasrawi is a senior academic and research leader in the Department of Computer Science at Al-Quds University. His work spans artificial intelligence, digital health, innovation systems, and technology-driven socio-economic development. His research interests include artificial intelligence and machine learning, particularly the development of predictive, explainable, and human-centered AI systems. He has led multiple initiatives in AI-driven health analytics, including cardiometabolic risk prediction, mobile health interventions, wearable-based monitoring, and multimodal data integration, combining clinical, behavioral, and environmental data. His work also extends to medical image analysis for disease detection and the clinical decision support. Dr. Radwan, please.
Thank you, Professor Yusuf. I think this is a golden opportunity to discuss such important issue in the MENA region, and I'm very happy to see there are really many audience who was watching this webinar. Actually, I just want to continue based on what Professor Mohannad just was mentioned. There was a report, a very interesting report, were prepared by EMPHNET, investing in artificial intelligence to promote public health. It is really an important issue. It is a time to discuss deeply how we can use and utilize the advantages of artificial intelligence in our region, especially in our countries who are really suffering from many challenges, that this technology could be really an added value. Very quickly, just to re-identify what do you mean by artificial intelligence for the people who really don't came from technology discipline. AI, it is a computer science discipline were designed to perform human cognition, reasoning, learning, problem solving, perceptions, and language understanding task within the computational power. Actually, the artificial intelligence could be divided in two major divisions: machine learning and deep learning. Machine learning, it is where there are many research were conducted in this field using supervised learning or unsupervised learning or reinforcement learning. Those are methods or techniques were used to utilize the artificial intelligence on set of data for different reasons, such as my colleagues they mentioned prediction, detection, or identifying or clustering issues in the data, and also further deep learning where we can advanced step in machine learning to handle complex and high dimensional data sets such as imaging and medical imaging. Now, the point is, as we saw in the global, the AI is now really fully utilized in many countries in the world, like EU or US or other advanced countries. They get this advantage from this technology. There was a question: this is really relevant for the MENA region? In this report, my colleagues they were really hitting a point, highlighting it is really an important time to think how we can make this AI so advantage for our region. There are many challenges in our region in terms of diseases, in terms of lack of resources, or in terms of utilizing or using the advantages of digital transformation policies and agenda that were start to be launched in our countries. So those are reasons enough to think as AI is really an important, and it's time to use this technology in our region. So to fill the gap in MENA region, I think AI it is an ultimate chance. And as Dr. Yusuf he mentioned in the very beginning of this workshop, it is not to think it is do we need an AI now, how we can really make this technology efficient, utilized in our medical sector or in our public health sector. So actually the revolution of AI start to be in the global since the COVID-19. COVID-19 was a global pandemic. People they were looking for solutions to facilitate and increase the efficiency of health sector facing this pandemic. So the AI was really playing an important role either in planning or decision support on case detections or clustering the regions or monitoring. There are many applications of AI at that time. So this is move the attention of researchers and engineers and also experts in the health sector to use this advantage of AI. So then the AI start to be utilized and a predictive modeling, which is the most publications and areas of AI application in predictive modeling. So they start to use these algorithms and machine learning algorithms to predict diseases, to forecast the spread of these diseases, to try to utilize the EHR data, social media, or other genomic data to help in building, advanced decisions toward that applications, either in diseases or in management or in planning. So then after that, people they start to recognize, okay, we can shift from prediction to diagnosis. Then things start to be more advanced, and now with the launching of open AI, open generative AI, and the natural language processing, things is become more easier, and people they can really get this advantage in more easy and simple way, so they can talk with with the AI, and naturally, and the AI can do many tasks in their behalf. So this is make the utilization and the usage of AI more easier in all the world, not just in our region. So, but at the same time, if we look to the to the health sector in the MENA region, there are also a source of data. There is a lot of of advantages and challenges at the same time that really could promote the utilization of AI in MENA region. So if we look to the EHR system, there are many countries in the MENA region. They already now utilizing the electrical health records. They have a lot of data, clinical data, so they have the information system. Then it is going to be much easier to utilize the machine learning and the AI based on that data. And as you know, this AI without data is mean nothing. So the main source of the AI is to have good data sets and the clean data sets. So these things I think now is available. Of course, there are some challenges how to collect this data in some sectors on some diseases, but in overall, I can tell from my knowledge in visiting the regional countries, most of the countries now they're already utilizing digital health or digital solution. Then the things it make them much easier. Now, if we look also more for examples in the world, or let's say in low income countries who really get the advantage of the AI, we find in this report like Zimbabwe or Nigeria or Mongolia, there are all countries they have more challenges than we do in our region, but then they have the decision how to use the AI and to make their health sector or this health system more efficient. So like in Zimbabwe, they use this system in building an AI powered based on WhatsApp as a chatbot. Then this is facilitate the communication and also serve areas with limited access to the health sectors. So these things make the service quality and the fair service accessibility much easier. So there are challenges, of course, but at the same time there are technology that can really help. In Nigeria also they utilize the AI for child health and immunization coverage for remote communities or faraway communities. There are also different countries in the region who really get so much aware about the usage or the advantage of AI, and they start utilizing that. Now, if we look like in the in the state of AI in the MENA region in terms of public health, we can find there are many researches or many documents or many publications focusing in diseases detection, prediction, diagnosis, and outcome modeling, in climate change, also in workforce performance. So I think there are really good initiative in using the AI or conducting research on AI. But from my experience, there are very limited real deployment of the AI solutions in the health sector, which is here the challenge. If you can Google for research articles, I think you can find many articles came up from these countries. So then that's mean the knowledge and the know-how and the science, it is there. It is there in Jordan, in Syria, in all these countries, in the MENA region. They do have the knowledge, and they do have good research and good models of utilizing the AI in different problems and in different challenges in their countries. But I think there is also a big challenge how we can really fully utilize these models in real applications or in a clinical application within the healthcare system. There are also countries in the Gulf state who made really serious steps, and they start getting this advantage of the AI, and they deployed the AI systems in their healthcare system, like what Saudi Arabia did. They already put their vision 2030 how to position AI as a central pillar in the national transformation. So they invest a lot of money, and also they start to develop national data bank, centralized data governance, which is going to be a very huge and important resource for researchers or experts and companies to use this data and to start utilizing and developing solutions to their country. The same United Arab Emirates also, they are now focusing on digitalizing all their services. So if you have a country that do have about 90% of their services already digitalized, then it's going to be much easier for you to build on top of that digital solution and AI or a blockchain or any mobile technology solution that can really solve the healthcare challenges. At the same time, also in Bahrain and Kuwait, they did steps, or let's say advanced steps in using and utilizing the AI in their systems. And I think Bahrain, one of the first countries who decided during COVID-19 to use the robots and also the AI solution in facing this pandemic at that time. And also, if we go to try to summarize what are the challenges that make the AI is not really fully utilized in public health or in health system in our region, I think from my experience and from the report that EMPHNET team prepared, there are really many challenges. One of them, it is like data privacy and protection. It is not just a general problem. It is should be really a regulation and also strategies and policies that can really help the AI developers and the experts how they can really protect the patient data or the people data, or also how to make really an efficient and protected solutions. The same also, not all these AI algorithms are really excellent in their performance, and they can really perform excellent results. So there also a challenge how you can avoid algorithm bias either in the training or in the testing or in the deployment. There are many challenges in this issue. It has to be really handled from expert who knows how to catch these biases. And the transparency and the trust. Also, it is not easy for healthcare professionals to trust and to believe in this, interpretation of AI. So this is also need awareness, education, and also and practical examples so they can believe and start to trust these AI solutions. Also, the data quality is a challenge. Most of our MENA region countries, they were depending on traditional and most paperwork and documented systems. So these data need to be really collected and tested in terms or cleaned to make sure it is really reliable for AI solution. And at the same time, AI also needs an infrastructure. So we need really a solid infrastructure for deploying an AI solution. And also, again, the regulatory gap, it's a big issue. It is really one of the challenges that can limit the utilization of AI in our countries. If we try to make a quick compare between the MENA and the world, MENA countries, they are really still depending on all the strategies. These strategies and policies need to be revisited and to more reform toward an AI utilization. You can find in many countries there are policies for digital transformation, but I think we still need the specific strategies, specific policies for specific AI solution. Let's say we need an AI policy for infectious diseases, for cancer treatment, for whatever. So these details of policies and governance procedures is still missing in our region. So I think there should be an effort to be done in this area to facilitate the deployment of AI. From my experience, again, I can say it is not the lack of finding the expert and the developer who can really develop a fantastic AI solutions or an efficient AI solution. I think the challenge is, are these systems is ready for AI solutions in terms of acceptance or governance or deployment, or let's say privacy and policies, etc. I think this is an area has to be really considered from researchers in all the world, and also from the governments, and also from the private sector who can lead the development of this technology in these countries. Of course, the WHO also they worked a lot in this area, and they wrote many documents in terms of ethical principle for AI in health. And we know WHO is the reference for many or most of the MENA regions or MENA countries in their healthcare system. So if we back to the ethical principle of the WHO, then things become much easier how to utilize the AI in our healthcare system. So they focus in protecting an autonomy of how human decision making can be really still there. Also, how to foster the responsibility and accountability, how to guarantee inclusiveness and equity, etc. So those policies are already there, but also I think need an effort from the government in this country to work toward utilizing and implementing these policies within the healthcare system.
Dr. Radwan, you need to be shortly.
I am almost done. This is the last slide, and I can say my recommendation. It is, we have to focus seriously in building digital solution founded by country themselves, and also we need to, as Dr. Mohannad mentioned, we need a collaborative work between countries, between universities, to build a solid network for developing AI solution. We want to invest a lot in workforce and in education and awareness toward even the health sector. The health professionals has to be well educated and aware about the power of AI. So there are many opportunities and also some challenges, and need to be taken and considered within the utilization of AI. So those are in brief, but I can tell and believe the AI, it is a golden opportunity for all of us, and we have to consider seriously how to advance our healthcare system with this technology. Thank you again. I'm sorry if I took more than time, but I'm trying to be informative as much as I
No,
can.
you were really perfect, actually, on time. Thank you so much. This is really very informative presentation, really very useful. And I do encourage our guest speakers, our respected speakers, to address the question. If you go to the Q&A, you can answer live the questions. They are really very interesting question that needs answer. Now we need to learn more, actually, and I'd like to introduce our third speaker, Professor Zakaria Bilharti. Professor Zakaria is an associate professor of preventive and community medicine at Mohannad Al University of Science and Health. He's an international expert in leadership, health policy, and health system research, and serves on the editorial board of BMC Health Services Research. He's also a member of MENA Hub for Responsible AI. It's worth mentioning that also EMPHNET is a partner of MENA Hub. He holds a medical degree and international PhD in medical sciences and public health. Dr. Zakaria, please.
Thank you very much for the introduction. I'm very pleased to be among all of you at this wonderful regional meeting and webinar. From my side, I will be presenting a different perspective on AI that would be around governance and governance gap, and to understand how AI solution, whether they are implemented, deployed, and what are the hurdles that limits the implementation in real world setting in our different kind of health systems and in public health in particular. So I'm building on the report that has been published by the EMPHNET. I'm very pleased to be invited to contribute to that. I would like first to set the floor that implementing AI in real world setting is something which is complex. It is what we refer to as a bunny world or a VUCA world. A bunny world is where we have a brittle, we call that a brittle world, where we have different fragmentation of data, fragmentation of health system surveillance, capacities, and so on. And we need to, despite these resource capacities and lack of capacities, we need to implement further the AI solution by governance and policy engagement and practice. Whereas the policy are there at strategic level, but the implementation gap are quite what hinders actually real implementation. And then this bring people to develop some kind of anxiety to reach out to the speed that the North America and the West easy, as you mentioned. And then the government, we need to adapt these AI solution to contextualize it to address the real public health challenges in the EMRO region. And then we need to also to recognize that implementing AI is not something linear. It is non-linear because it is characterized by non-linearity, unpredictability, and complexity. Because non-linearity, for instance, during COVID-19, where if an AI predictive model show an error that could have a huge impact on population and life of people. So we need to take that into consideration as well for using responsible AI. And then there's also another aspect that hinders the adoption of AI solution when it is implemented in healthcare facilities and primary healthcare setting, in hospitals, which is the fact that AI solution needs to be understandable, need to be explainable, need to be transparent enough to allow that the health workers, nurses, midwives working in a hospital to make sense of that decision-making model and to address and to improve their decision-making, to improve the health of population, which is all about, this is all about, is to how to improve the population, the health of population. That when we speak about the EMRO region, we don't speak about a homogeneous set of countries. We speak about a very, very, very heterogeneous type of countries with different type of challenges. One of the challenges, if we have the report from WHO, EMRO, we have 166 disease outbreaks since 2020, 2028, 2022. And we have more than 127 million people displaced, needing accurate access to care and essential care. And within that, we need to address also the other elements and challenges such as natural disaster, earthquake in Morocco, conflicts, human-led conflict, and forced displacement. Within all these contexts, we need to make sure that our report also highlight that most of the AI that have been developed so far in the north and so on, and what have been uptaken by the different countries in the region, focus on clinical care and mostly from curative care, but the neglected and an essential element, which is public health and health policy and health systems. How can we strengthen health system to function well using AI? How can we strengthen decision-making of public health professionals, of policymakers to make accurate decisions, transparent and equitable to address the gap in access and quality of care within our different settings? And the idea is that also the need for emphasis on community preventive care, which is our efficient, as WHO mentioned, rather than moving with the commercial influence of private market-driven reform that actually foster countries to adopt AI solutions that are actually funded also by private company. And there is some kind of need to make sure that there is no commercial influence over public health values. Just a reminder, I was just trying to make sense of the state of the art where our regions is. And the idea is that when we look at our region with the Middle East, it's the orange dots. We are quite lagging behind, not behind, but at the middle. As the Middle East, we are in the middle. But we have also, as I mentioned, heterogeneous readiness status. If you see here, the more it's blue, the more there is a mature infrastructures and AI readiness in countries. We have the Gulf countries, we have North Africa, it's getting into it, but in comparison with Sub-Saharan Africa, but we are way beyond Europe. And if you look more at the governance framework that assess whether these EI solution implementation or EI technology, we need to look at governance framework that could score and assess whether our countries have the necessary governance and policy capacities to implement EI in a responsible way. And when we look at the scores, we know the different high scorers, United Arab Emirates, Qatar, and we focus on government actions. But what we could focus and emphasize is the lack of non-state actors involved in AI implementation in our countries. We could also focus on the responsible AI capabilities. And this brings the discussion of Dr. Mohannad, who mentioned that capacity building, capacity development in AI responsible AI use is crucial. And when we look at Morocco and North Africa, it's often attached to Africa as well. It is quite doing well in terms of governance and framework, although the legal framework are comprehensive but don't focus on specific AI solution. But maybe it's also need to take into consideration that each policy of AI need to be contextualized to the government framework that's actually in place. It should not be disentangled from the actual policy framework in place, whether it's digital health network policy and so on. So, and if we look, so actually it has been already mentioned before by, it's around the principles, but I would like to focus on 1, 2, 3 elements, is that AI could generate a self-confidence bias amongst policymakers that could less rely on evidence, less rely on rigorous, solid evidence in making policy decision rather than using AI as a solution. There's also risk of increasing the digital divide because not all have digital literacy. So we need actually to build policies that address the equity and access of vulnerable population, migrant population, people in a displaced population, and to allow them, to empower them to participate in such initiative rather than building well-designed policy without actual impact on population and healthcare. There's also the regulatory legal compliance. We need to be coherent with that and avoid one element that I'm very aware of is commercial pressures. There are market-driven pressures that need to be counteracted by public health professionals in order to maintain the public interest. And I was looking at the evidence around the region and to understand what are the gaps in terms of governance of AI in our region. And I only found that report or commentary that had been actually integrated in the report, and that mentioned the fragmentation of digital health governance in our region, the lack of interaction between actors and countries, the lack of platforms that allow exchange because of policy-driven conflicts and so on. But the idea is that knowledge sharing, knowledge translation is a key element element of strengthening capacities of the region. And we need also to not ignore language inequity, because we do speak Arabic in the region, but many speak other languages. In Morocco, we have Amazigh in the different type of Arabic languages and dialects. And we need to be aware of this diversity when developing LLM models and so on. And finally, we need to focus not on building individual capacities, but building institutional capacities to address the vulnerabilities and inequities. If we look more in depth on these governance framework, for instance, the Oxford Insight ranking, that focus on policy vision, policy commitment. So we need to foster capacity building in policy formulation, in building institutional capacities, in driving the e-governance policies. We need also to build societal transition and empower communities, empower actors at the society, because they are the users, they are the beneficiaries of any public health reform. And I just try to compare our region with the North Europe. We are way beyond, and we are in the middle. We are the blue radar. And then we do have the South and Central Asia. We're doing quite well as well, but not that well. So for the what would be the recommendation and take-home message? I'm not going to recall the principles of responsible AI, but I would like to emphasize the importance of contextualization to each country, because we have a political, social, economical disparities, and no one best way strategy will fit all our contexts. But we need to build synergies between our countries in order to build a platform of knowledge dissemination and knowledge sharing across regional networks and hubs. And one of these elements would be also to build capacities of countries in terms of assessing readiness. But one we call about readiness is the institutional readiness, the capacities, the maturity of digital platform within the actual country. We have done some with in Morocco, but also I would like to foster that there are some initiatives, the MENA Observatory, but also there is also the Gain MENA, which has been also in partnership with the EMPHNET. And I would like to emphasize also on that. And finally, just to share our own experience in Morocco, we have been developing evidence around clinical decision support system through a published scope and review, but also some report around the implementation science. How can we implement in real world setting, in rural, remote areas? And this is the actual research that we need to build evidence on, which are implementation. In short, what are the policy gaps? 4 capabilities gap, or four gaps. One is the policy gap, which we need to address throughout sensitizing, working with policy debate with actors at high level in order to define the current policy, analyze the current policy, and build up on these gaps to refine the actual digital policies around AI and other digital policy and technology. Scientific knowledge, we need to rely on robust evidence to quietly inform in a responsible way policymakers. We need to avoid digital divide between people in rural and not segmentized people. And we need to capacitate societies, NGOs, non-profit actors need to be also within this ecosystem in order to build ownership of AI. And finally, 4 take-home messages. Democratization of use, because not everyone should be, not because it's a wealthy nation, should have access. We need to democratize the use, democratize development, share knowledge, democratize the benefits, because benefits should address the inequitable, the vulnerable, and displaced people first, and then the others. And then democratization of governance. So more social accountability mechanisms, more participation, more inclusion. And finally, I would like to focus on one framework that we've been developing in terms of knowledge dissemination, knowledge translation. In order to institutionalize the AI governance in our countries, we need to look backward. We need to focus on standards, routine, procedures. Which procedures we need to standardize? We need to build leadership for responsible AI and commitment. We need to build synergies and partnership between our countries. We need to foster governance. We need to provide resources, shared resources, depending on our income. And we need to promote a culture that will lead to a routinization of the use of AI in policy and evidence. Finally, advocate people-centered digital health system. Evaluation, research on evaluation is essential, and building regional, national, and even decentralized sub-national stakeholder collaboration. Thank you very much. In a context of policy crisis, we need resilient health systems because we know our healthcare challenges, but AI would not address that. It will be a lever. So let's be resilient to adopt, embed our AI technology within our policies for the people. Thank you very much.
Thank you so much. Thank you. This is really amazing. It's very nice presentation. Thank you. And thanks for highlighting the key challenges in e-governance in the MENA, including fragmented systems, workforce and capacity gaps, cybersecurity risk, commercial pressures also, and neglect of equity and bias. Thank you. Now I'd like to move to our next speaker, Professor Mustafa Ali. Professor Mustafa holds a PhD in computer science, artificial intelligence from Wayne State University in USA. He's currently a professor in the Department of Computer Information Systems, Data Science at Jordan University of Science and Technology. He serves as an associate editor for several reputable scientific journals. His research interests include artificial intelligence applications, machine learning, deep learning, evolutionary computation, and virtual and augmented reality. He is really expert in this area, and gamification. He is a member of IEEE, the IEEE Computer Society, and others. Dr. Mustafa, please. You are muted, Dr. Mustafa. We see your presentation. Do you hear me, Dr. Mustafa?
Can you hear me now?
Absolutely, yes.
Okay, sorry for that.
Go ahead.
Okay.
Yeah.
Hello, everyone. Thanks, Dr. Yusuf, for the introduction. Today, I will present, the usage of AI from a different perspective. Artificial intelligence is, how it's really transforming public health, not only for the prediction and analytics, but increasingly for training and decision making. Most importantly, I will highlight how explainable AI enables us to understand and trust these intelligent systems, especially when combined with immersive technologies like AR, VR, MR, to create adaptive and transparent training environments. So, as we all know, AI is already widely used in public health. It helps predict disease outbreaks, optimize resource allocation, and support policy decisions. Most of these applications focus on analyzing data and generating insights. However, there is a critical gap. AI systems focus mainly on prediction, but they do not train professionals to respond to complex real-world situations. In addition, many AI systems are black boxes, making them difficult to trust. And this is where we come from. So, as an application, immersive technologies such as virtual reality, MR, AR, provide a new way to train healthcare professionals. They allow users to experience realistic scenarios, practice decision-making, and learn in a safe environment. Now, several studies analyze such virtual environments for surgical training data, for example, using machine learning. They extract kinematic features such as motion smoothness, trajectory efficiency, and timing. Models like random forest and support vector machine can classify expertise levels with high accuracy, often above 85%, let me say between 85 to 90%. This shows that VR is not only immersive, but also a quantitatively measurable, tool that we can use side by side or as an environment for our AI training. So in healthcare, Explainable AI, as we all know, is widely used to interpret predictive models. For example, SHAP values, they quantify how each feature contributes to a prediction. In disease severity prediction, factors such as age, oxygen levels, comorbidities are identified as key contributors. This is critical for trust and decision making. Now, research explores combining VR, AR, let's say virtual technologies and explainable AI. Instead of giving a score, we use the system in order to map performance errors to interpretable factors. For example, it can show that tool instability or, let's say, delayed response contributed most to poor performance, which is something that we don't usually see in trainings. Okay, especially when we have, like many trainees. For example, it can also be used to, like measure other factors, but the key step here is toward explainable training systems. Most exciting research focuses on individual surgical training. However, there is a clear gap in applying these techniques to public health systems. We can extend these approaches to simulate pandemics, hospital overload, and resource allocation decisions. This represents an important research opportunity here. So, as we see here, these are not generic future ideas. They are active research directions. Reinforcement learning is being explored to adapt training scenarios dynamically. That's from one side. From the other side, digital twins allow simulation of entire healthcare systems using real data. And from another side also, multimodal explainability extends XAI beyond static models to explain sequences and spatial decisions. Also, let me say finally here, collaborative virtual reality, or let me say virtual systems enable team-based training, which is essential in public health. Okay, but this is, again, it's just a tool here. And recent systems, and let me give an example of how it's really used in practice. Recent systems like Precision OS, built using Unreal Engine, as a platform, show that virtual platforms training can significantly improve medical education. In fact, studies report that surgeons trained using these virtual systems can learn up to 5 times faster. Now, this is because virtual reality allows repeated practice, exposure to multiple scenarios, and learning from mistakes without risk, to patients. And this demonstrates the power of immersive training in healthcare. And, in this, when we use this combined with AI and, let me say explainable AI here, it's really going to make a difference. Because, unlike other engines, they just, either show you the environment and you just can see, like one scenario that you can modify manually, and it doesn't smartly adapt to the situations, or let me say, to how you are really teaching these other surgeons. So systems like Precision OS are built on on engines such as Unreal Engine. They rely mainly on real-time rendering for realism. Physics engines for interaction, and VR hardware for immersion, in addition to, which is actually the thing that we are doing right now with the medical school in DMC in Michigan, with AI in order to provide explainable AI and also the adaptive scenarios. Crucially, they also capture detailed interaction data, including motion, timing, and tool usage, which forms the basis for analytics and future AI integration. This is, something that really shows how this is really being used. This is the engine that we used in order to prepare that virtual environment, which is also being prepared with AI. It provides adaptive environments, as we see here, and we can code it in order to provide that, adaptively. Despite their effectiveness, current systems are mostly static, like I said, which is the thing that we really come from here. Scenarios are manually designed and do not change dynamically based on user performance. This limits personalization and reduces the ability to simulate complex, evolving real-world situations, especially in public health contexts. That's why recent developments allow the integration of machine learning into Unreal Engine environments. The developed one. Models can be trained externally and connected at the same time to the simulation, enabling adaptive behavior. So, for example, the system can detect user errors and dynamically modify the scenario based on how we really need it, which opens the door to intelligent training systems here. Explainable AI then provides transparency, explainability of why these adaptations occur. So in conclusion, we are moving toward a new paradigm in public health training. Virtual reality provides immersive environments, while artificial intelligence enables adaptive learning, and explainable AI ensures transparency and trust. Together, they allow us to move beyond simply evaluating performance toward understanding decisions and improving them. This has the potential to significantly enhance preparedness for real-world public health challenges. Thank you.
Thank you, Dr. Mustafa. Thank you so much. This is really very interesting. I'd like to now finally, I'm pleased to introduce our friend, Engineer Tiago Masroor. Dr. Masroor is the General Manager of the Centro Ciencia and Vida Scientific Research Center in Chile. He also coordinates the ECLIPSE Consortium and contributes to the global development of the Health Forecasting Alliance, supporting its strategic vision and regional collaborations across a network spanning 37 countries. He holds a master's degree in global technology and development and a bachelor's degree in computing engineering. His work focuses on sustainable development, technology, intellectual dialogue, and human rights. Engineer Tiago, please.
Thank you very much for the invitation. I feel like I'm the outlier here in the group, not just because of my background, but also because of the distance. Thank you so much for allowing me to participate here with all of you. It has been quite a stimulating panel and an overview of everything that is happening in the region. And so I would just like to add a perspective or an experience from what we have been developing in Latin America, which we can consider as a journey and an experience that is ongoing and that is being developed right now. And that started as a very, I would say, limited regional approach, but that gradually has explored new avenues. And through EMPHNET, we have been collaborating more and more over the past couple of years in the MENA region. And what I've heard so far, I think, reflects very well our own reality here, which is the same challenges that all of you have mentioned in the previous presentations, and I believe all the participants have one way or another encountered. It has to do with fragmentations, with lack of access to proper data, with impacts that are coming not just from inside our countries, but actually from other countries and other regions. COVID was mentioned many times, and I think we're still remembering the impact it had in our lives, but also due to our constraints in terms of resources and, as was just mentioned, in terms of capacity development and implementation. And so from a regional perspective, we asked ourselves a few years ago, what can be done when we're talking about forecasting health? What efforts can be taken into that direction? And so an effort was developed, starting with 8 countries that now spans over 13 countries in Latin America, where we established a community of practice around a series of shared concerns. We established working groups, we were able to develop a common language and tools and references. We identified the use case that were more impactful at that moment for us. And as I mentioned, the community of practice was the linking element that allowed us to have an open conversation, not just among public or governmental institutions, through the Ministries of Health or the National Institutes of Health, but also through academia and some technological experts or proponents. And so we identified 5 pillars around which we worked. The central one, the initial one, is the community of practice, a collaborative space where we all work together. which in turn allows us to identify and develop federated analytics and model exchanges. And that is really the richness of the work of bringing together all these countries and all these experts and different peoples, these different views around health and forecasting. On that, we used whatever resources were available in the different countries and within the different institutions in terms of computational capacity. So the computer science was not a prerequisite. It was actually a tool that was used or that is being used as we need it and when we need it. And we moved based on those capacities organically, gradually. And then there is the fourth pillar, which has been mentioned, I think, by everyone so far, which is capacity building, the development of knowledge, the sharing of that knowledge, both on an academical and more formal perspective. And so there's a few master's and PhD programs involved in all these efforts, but there's also a more informal or a more direct sort of capacity development, which has to do with learning how to use the tools, how to make them more beneficial to different groups and in different settings. And finally, the main output of all of this is to be able to support decision and policy making. And not just in the sense of how we address artificial intelligence or its use, but actually how the forecasting of health significant issues for our countries do impact policy. As we well know through experience, the main challenges around COVID were not necessarily the medical expertise or the technological support that was required at the moment. It was developed and advanced very quickly, but it was the capacity to make the proper decisions at the right time. And this is where we have found that the greatest gap exists between a scientific or technological approach or an academic one to policy making at the highest levels of government, where the language is not always a common ground. So this is one of the pillars we've been working and developing further. This has taken us to perhaps one of the greatest challenge, which is data availability. And again, it was mentioned a few times, data that we have is not always of good quality, is not always available at the level we would like it, whether it's geographical or in terms of its timeliness. And also, not everyone is able to share or access the data in the same way. So for that, we do turn to artificial intelligence to be able to let the data sit where it needs to be. So if it cannot move from a local or a national repository, it stays there. But the components of artificial intelligence that are being developed goes to the source, works from there, is parametered and is modeled around it. And what comes out of it are the insights and the results that then can be shared with the rest of the participants and the rest of the countries. And that's how we start generating this virtuous cycle between data that is sovereign to each country or to each institution, not moving it from there, but actually taking the best result out of it and making that wealth for everyone. So this is really the regional collaboration model that we've been working on. To support all this, we are also moving forward, and I'm just going to mention it quickly here, in terms of digital public goods, which is the backbone, which is the foundation upon which we can build all these other layers. And so this is, I would say, the conceptual development and approach we have been working around. In very practical terms, there is the case of the 2025 outbreak of yellow fever in Colombia, where the Colombian government had been working with PAHO, the regional branch of WHO, around a model, but they were unsatisfied with the model. So they turned to the regional consortium to see if there was something else that could be done around that. And we turned to one of the partners of the group, which is another research center in Brazil, Fiocruz, which was able to use the model they had developed over time in Brazil in their very specific context and open it up to a larger perspective and application of the models of artificial intelligence to yellow fever to other countries. And this allows us to have a very precise resolution down to 30 meters in terms of movement and specificity of the cases, a priority risk zone mapping, and therefore to transform it or translate it into actionable policies. This is done through, for those who are used to AI, a very normal workflow of modeling and testing and refining the different elements and parameters. There were over 900 variables that are being considered. And we were able to confirm that a country-specific solution can then be translated to other countries in a very straightforward way. So this is the example of the many layers that the Brazilian model will use, the levels of specificity in terms of geography from 1,000 to 500 to 100 meters down to 30 meters in terms of being able to pinpoint specific cases and their movement through time, which resulted in an assembled model that started with over 1,000, almost 200 different models that are recombined, that are reevaluated, and with a result under the curve of over 80% in terms of confidence, allows us to focus on 532 models that in turn generate a heat map around yellow fever. This is the case for Brazil, and it's being translated to the data available in Colombia. From there, other countries such as Argentina, Peru, Paraguay, Uruguay are looking at the model to see how it can apply to their data, even if it's limited data, because the model has already been trained and can be easily updated and functioning in other settings. So what I'm trying to share here is that starting from a community of practice, where we brought like-minded people with common interests and common concerns, the application of a specific group of tools and knowing the limitations around data or even around capacity, we're able to overcome and move forward to establish this functioning consortium and development. And this has served as sort of a blueprint, an ongoing experience blueprint of looking at sovereign regional collaboration work that is taken to a new level. And that's the Health Forecasting Alliance, which is establishing itself as a network of networks, where different networks are collaborating to form this vision around health forecasting and development. And it's designed really to build national capacity from the bottom up, allowing predictive models that have been developed in Latin America, but are also being developed in North America, in the Middle East and North Africa, and in other regions to adapt the best of these practices and uses. And therefore, what we are already seeing is this rapid validation and potential adaptation of different models. And so to conclude, and again, I think it aligns very well with the previous speakers. When we're talking about investing in AI for public health, what we're talking about is investing in collaboration. It is not just the technology and the tools and the capacities around it, but it's actually the capacity to connect with one another and to, through the people and the systems that support them, mitigate future threats and the dangers that expose us every day. So thank you very much. I hope this has been a contribution from our region to the Middle East and North Africa region too. Thank you.
And indeed, thank you. Thank you so much for your contribution. Definitely, you are not an outlier in this group. We have been working together since the last year. EMPHNET, working with VitalWave and CDC and Tiago Group to establish community of practice. We call it MENA Collaborative for forecasting and outbreak analytics. And basically, this initiative is progressing very well, and it will be launched soon. It aims to enhance early detection and response to outbreaks by shifting toward proactive, AI-driven forecasting while enabling collaboration across countries through federated approach that preserve data. EMPHNET plays a key role in coordinating this effort, supporting collaboration and advancing the capacity building and the implementation across the region. Am I right, Thiago? Thank you.
Absolutely. Thank you.
Thank you so much. Now, really like to highlight that this is the first maybe webinar among our series at EMPHNET on artificial intelligence. We wanted this, webinar to focus on challenges and current status in the region. Definitely, we are thinking of new webinars, future webinars very soon, with a focus on AI use in public health, in surveillance, and response to outbreaks. So if any of our attendants, and I see that really very good number who are joining us today, if you feel self are capable and with expertise in this area, let us know. We can work together, to arrange for another webinar. We received good number of questions, so I will be selective because we have only 15 minutes to answer these questions. The first question from Dr. Ahmed Mandil. I lost your comment, so just a few seconds. He was asking about the terminology. He's saying that, people talking about AI, they are coming from IT background. For health professional, we need basic concepts. We need something that we can understand. What do you suggest? How we can help in this? Anyone would like to answer? Go ahead.
Yeah, please.
Yeah.
So I think that it's not about simplifying concepts from ICT and develop new engineers and doing the AI machine learning, supervised learning, and so on. But the idea is that to work with people, to empower people, to foster, to work with them. We don't develop AI solution for us as a research community. We work with communities and building capacities and working with the end users, because we need the end users of the AI solution should be the aim, and should be the driver. And therefore, there will be capacity building courses, but rather than classroom teaching and classroom webinar, we need to foster hands-on training, and working in the ground, in the real world setting would be something that we could add for them, rather than saying, yeah, it's complex concepts and they are the respondents, and we work with them to engage them.
Yeah, thank you. Now I see that we have 215 person joined us at the moment. I'm sure that all of them want to be expert in AI use, in applying and implementing AI interventions. But I'm talking about myself as coming from health professional. I find it really very difficult to understand the concept and terminology. We need that course and that module, introductory module, that explain the concepts and applications of AI to health professionals. And this is basically in our plan at EMPHNET, in our strategy to lead the training in this area for the region. Dr. Radwan, do you like to comment on this?
Yes, I think this is really very important. This is one of the most challenging of AI. Most of the people, they are coming from non-technology background, and they are so motivated to use or to deploy AI in their sector. But as Dr. Zakaria mentioned, it is not about how to program and to understand the mathematical and the engineering aspect of AI. It is to understand how to utilize AI. But also AI itself now is providing an assistant for people to understand AI. So I think there are also open generative AI solutions who really can help you how to work and develop a full solution on AI. And I think if you really came from a background, let's say nursing or physician or whatever, you are the subject matter in that field. You need from us few intervention or some literacy, how to understand or to program or to develop simple AI solution. Then you will be the leader because you know your subject more than I do. So I think you can really make good solutions. This is the issue. We need to use the AI to learn from AI.
I got you. I got you. Yeah, I have a question to Dr. Mohannad. Professor Hassanin Ghazi, he asked Dr. Mohannad about Iraq because he did not mention it in any tier. So he might be interested to know in which tier Iraq fall. Dr. Mohannad?
Sorry, Dr. Yusuf. Can you repeat the question? Sorry, I was.
When you classified the countries in tiers, there's a question about Iraq. In which tier it falls?
Yeah. I tried to find Iraq, but I could not find a good reference for that. So I avoided to mention Iraq in the presentation just to, I was not certain, I was not supported by evidence, for where Iraq lies. But I think, from my experience with Iraq, I think it's somewhere in the tier 3. But again, I did not find any reliable resources for that. So we can check again with colleagues from Iraq. I think Dr. Salman Rawaf with us, Yasser with us, Faris with us. So we will make sure to find Iraq, inshallah, and work on it together. Thank you for the question.
Thank you, Dr. Mohannad.
Actually, I expected this matter before the...
Yeah, from Iraq or from other countries?
Yes, from Iraq, I think.
From Iraq. Good. I have a question from Dr. Al-Junaid. He is asking about how can countries develop, update their strategies to ensure that AI investment are aligned with national health priorities rather than driven by a technology trend? What kind of governance? I think Dr. Zakaria, you can answer. What kind of governance is needed to scale AI in the health system?
Oh, yes. So to avoid donor dependency, to avoid to build our own ownership of our policy, it need to be contextualized to our setting by our people, by the government, within some kind of sovereignty and within some kind of alignment with the contextual and policies that are already there. There need to be also an engagement of senior actors who ratify many conventions at the WHMRO, at the region, and so on. There's high-level stakeholder engagements where governments get together, they adopt policies at higher level, and there's also the regulatory framework that are one way to implement that. And then the other aspect is procedures. Write it down. Don't write it down. Procedures, routines. So these are elements around to contextualize to avoid donor dependency. But now we know that there are some low resource setting, and this is something that deals also with stewardship and leadership. You could you could be somewhat dependent on some funding and so on, but at the other side, there's some leadership and stewardship and public interest that could be the vision, the underlying vision underlying it, and it underlie policy formulation. So this is how I see things. There's no one best way how to do it because it's complex, but
Absolutely.
The idea is to get the values-driven, public interest-oriented policy making rather than dependent on donors.
You are right. Yeah, thank you. Guys, we have really many questions. We cannot answer within this time, but definitely we'll answer all questions. So I'm trying to pick the question. Some questions have terminology that I cannot and abbreviation, so I will skip them. Maybe will be addressed by our expert later. I have a question from Dr. Nada Ghosn. She's saying first, greetings. Thank you for the presentations. In order to adapt the AI tools in our region and countries, we need to have locally training datasets. How far can we find local clean datasets for AI? Maybe Thiago will answer this. How far countries are building and maintaining local training datasets. Any answer to this? Yes, Tiago.
In our experience, it has been a challenge without a doubt. Even countries such as Chile that has a wealth of data fall into the trap of not maintaining it well or using formats that are later on very difficult to reutilize. And so it makes the data of little value or very difficult. And so in our case, the combination or the alliance with academic groups has been very important because there is a wealth of capacity and resources available of people who can go into the data and work very systematically in cleaning it up, in preparing it, in working around it to have what is required. But the question before that is, what will be the data you will need and how it will be utilized? And so there's a series, again, we go back to governance, we go back to understanding the framework in which we want to work to make sure that it's not to have data just for the sake of data and having as much as possible, but actually to have the right one that will respond to a proper set of parameters, a proper design, a proper model, and that will answer to what impact we're trying to achieve and with what protections and safeguards around them. So there's a series, I would say, of setup before even getting into the data itself, so that then it streamlines the rest of the process. At least that has been part of our experience here.
Thank you. Thank you. And now I'm gonna summarize these, presentation, and I see that while notable progress is being made, particularly in Gulf countries in our region, the translation of AI innovations into scalable and sustainable public health solutions remains limited. Bridging this gap requires more than technology. It demands strong governance frameworks, a skilled workforce, and effective regional collaboration. Experiences from Latin America clearly demonstrate that successful AI implementation is not driven by algorithms alone, but by collaboration, trust, and well-structured governance models. In this context, EMPHNET is uniquely positioned to lead this transformation in the EMR by leveraging its legacy, regional presence, technical expertise, and strong partnerships. EMPHNET can connect countries, build workforce capacity, and promote standardized, practical approaches to AI integration in public health. Through this leadership, EMPHNET can help ensure that AI is applied ethically, equitable, and at scale, translating innovation into real impact. Ultimately, the goal is clear: to harness AI not only to advance technology, but to strengthen health systems, promote equity, and enhance regional preparedness for future public health threats. Finally, I'd like to extend our sincere thanks to all our distinguished speakers for their insightful presentations. We also express our appreciation to all participants for your engagement and interest. Your participation reflects the growing commitment across the region to advancing innovation and collaboration in public health. Thank you for all being part of this important dialogue. Thank you.
Shukran. Thank you very much. Thank you.
Thank you.
Thank you.
See you.
Thank you all.
Thank you.